Okay, in line with the theme of being techie in this particular convention, and because this is my most favorite app in my iPad and in my iPhone, and I tweaked my title a bit into this title. The Ways of Childhood Leptospirosis, Outsmarting Leptospirosis Together. But for those of you who do not understand what it is, simply put, I'll be talking about the clinical practice guidelines on childhood leptospirosis. And this time, so what will be different from last year's? This time, this would be the core group recommendation already, as what Cecil was already done also for the CPG for the bacterial meningitis. So we'll be focusing on diagnosis, treatment, and prevention of leptospirosis. And because this is a core group recommendation already, and I know that your brain cells are slowly dwindling and you're trying to stay awake, then I will give you a role, okay? Since we're giving you the recommendation, I just wanna get a feel of the group and see, para may app din, diba? Like or unlike yung recommendation, okay? Yan ha, para meron kayong role as audience. Oh, this is my disclosure of interest. This is a better picture than the other one. Okay, let's see. Okay, we'll spend 5 minutes on my picture. The PDSP has actually deemed it necessary to develop a clinical practice guidelines on leptospirosis primarily because of these two things. One, we have the reservoir with us. I know a lot of households now will have their pets, the Ratus ratus and the Ratus norvegicus. No, they're there in your households. And, or plus, the innate nature, the love of the Filipinos to have fun amidst crisis and even in national disasters. Diba, ginagawa nila mga diving board, yung mga bubong. Diba? So that innate love, more fun in the Philippines talaga when there are floods. So the rat plus the floods, then we expect really an emergence or an increase in cases of leptospirosis. And in fact, in the year 2013, among the top 10 health stories by the Department of Health is actually the outbreak of leptospirosis in Olongapo. That was October 2013, wherein they actually reported around 210 cases and 6 deaths from leptospirosis in only 48 hours. Okay? So we move on now to business. So for the diagnosis part, Cecil has already, thank you Cecil for discussing how the CPG was developed, etc., and how we're coming up with the recommendations. So we're also using this WHO assessment because it's simpler to use with regards to the strength of evidence as well as the strength of recommendation. Okay. So this is your first question with diagnosis. So what clinical manifestations should make one suspect leptospirosis in children? Unfortunately, there really is very, very little data or researches on children alone. Most of the researches and clinical trials were either done on both children and adults in one study or exclusively in adults alone. So from these 98 studies, we have only included around 5 studies done exclusively on children. So yung recommendation po namin, talagang for children. No? The studies were done exclusively on children. And what was the result? So the top 4 symptomatologies found in leptospirosis confirmed patients would be fever, abdominal pain, myalgia or joint pain, and headache. And then the top 3 signs would be your calf tenderness, jaundice, and hepatomegaly. Now, this is actually more for your FYI. In our literature search, we've come up with the FAINS criteria of the WHO. The WHO has recognized that laboratory tests may or may not be helpful in the diagnosis of leptospirosis or may not be available at all times. So the WHO has crafted the FAINS criteria, which actually included 3 parts. Part A would be clinical data, Part B would be epidemiologic factors, Now, for this original WHO criteria, the epidemiologic factors would include contact with animals or contact with known contaminated water. And collectively, if we have it, then you're given 10 points already. Now, part C would, of course, be your laboratory tests. Now, in the modified FAINS criteria, the difference is that for epidemiologic factors, they actually specifically assigned scores for each. It's not collectively 10 points, but assigned specifically points for each. Like rainfall will have 4 points, contact with contaminated environment will have 4 points, animal contact will have 2 points. But the total points there would still be 10. Now, just to make it a bit more clearer to you, so I'll show you the part A. Part A, if you have a total score of 26 points, then you can say, this is presumptively can be leptospirosis. Okay? So this is clinical data, your part A. Now, if you look at conjunctival suffusion, meningism, and muscle pain, it would have, each of it would have 4 points. But if all 3 were present, then there would be an additional 10 points. Okay? So parang may bonus point na plus 10. Parehas then, or same is true in the modified FAINS criteria. So if all 3 are present, then you will have additional 10 points. Now, fortunately, we have a study done at Philippine General Hospital by Mayan, which looked at modified FAINS criteria and actually locally modified it a bit based on what they saw as the most common signs and symptoms locally in pediatric patients. Okay? So now they call it the pediatric locally modified criteria. Now the bonus point is the one which is different, because for the modified FAINS and the FAINS, you will have 10 points if you have the 3. Conjunctival suffusion, meningism, and muscle pain. In the pediatric locally modified criteria, because these were the 2 most common symptomatology that were seen in patients with positive MAT, your microscopic agglutination test for leptospira, then they modified that a bit and put 10 points for the presence of only 2, which is your muscle pain and conjunctival suffusion. Now, the only disadvantage or the limitation of this study is that it is done in a pretty limited number of patients, right? So, this is a challenge to you. If you want to really develop a scoring criteria, and then this is a very good research, to really develop that scoring criteria, making use of the clinical data, epidemiologic factors, and even the laboratory tests for leptospirosis. Okay. So from the modified FAINS, they validated it with math. And what is interesting in that for the pediatric locally modified criteria, the sensitivity is pretty high at 80%. So what does that mean? Pwedeng gamitin as part of a screening for an early diagnosis of leptospirosis. Kaya nga lang, konting subjects, so you can do research on that. Okay. Now, we know that the MAT is still considered as the gold standard for the diagnosis of leptospirosis, but your MAT has a lot of limitations, apart from it making use of live leptospiral antigens, which will be hazardous to the laboratory technicians. The limitations are as follows. The antibody titers rise and peak only in the 2nd to the 3rd week of illness. So what does that imply? It's very difficult for you cannot use it in the early part of the illness. Now, because you will get those antibody titers rising only during the 2nd to the 3rd week. Okay, secondly, the high titers of past infection persist for a long time, and therefore what you will see may be the antibody titers from that past infection. Or a positive titer may represent a rising titer from a current infection or a decreasing titer from the past infection. So, we ask this question. So, kasi si math, we see, okay, it's less sensitive, it's very tedious to do, it involves live leptospiral antigen. we have a lot of rapid diagnostic tests. So the question is, which among the rapid leptospiral diagnostic tests is or are most useful in establishing the diagnosis of leptospirosis in children? So this is now based on the literature review that were done. In that review, it was really the ELISA test that would have the most studies done to it. It's a very good sensitivity at almost 98%. However, with the help of Dr. Banyas yesterday, we were calling hospitals all over Metro Manila, and there was no ELISA test in the Philippines. So what we have as the usual agglutination test or the CARD test or the immunochromatographic tests, which, well, if you look at the table, okay na rin, no? Sensitivities are around 70 to 90% also. And just for your information, ito yung mga tinawagan namin kahapon. I presented a similar table last year, but last year's table was outdated already because all these laboratories keep changing their laboratory tests. So this is hot off the press from yesterday's call. Okay? So we do have math, which is available at the PGH and RITM. Also have that culture in PGH and RITM. Now what we have in the medical city would be the leptospira antibody test, IgG-IgM test. Medyo mas mura, no? 780 pesos. What they have at NKTI is the immunochromatography test. It's just a card test. And in St. Luke's is the leptospiral antigen test. Okay? UST wala na yata, UERM wala. Okay, so coming from those slides, so these will now be our recommendations. So what clinical manifestations should make one suspect leptospirosis in children? So this is our recommendation. In patients presenting with fever, abdominal pain, myalgia, joint pain, headache associated with calf tenderness, jaundice, and hepatomegaly, leptospirosis should be clinically suspected, okay, based on evidence, on moderate evidence, and we strongly recommend it. Now, with regards to the laboratory tests, for the rapid IgM test, yes, they may be useful. We're not saying yes, you do it. They may be useful for the early diagnosis because of the sensitivity data that was shown, but you have just to know when to get it. Since you know most of these are antibody tests and antibody titers rise the earliest at 5 days in the course of the illness, then you do it at least 5 days. Okay. So strength of recommendation is strong, and the strong evidence and strong recommendation. Now what about math? Math is the gold standard. Yes, it's the gold standard, but it has, as mentioned, a lot of limitations. So math is used for epidemiologic studies and purposes only. So we are not recommending math as a routine diagnostic test in leptospirosis. And, of course, since these laboratory tests may or may not be available, then there is no need to wait for any of the laboratory test results prior to treatment initiation for a clinically suspected leptospirosis. Okay? So again, we have that strong evidence and strong recommendation there. Okay. So that takes care of the diagnosis part. Can I see your thumbs up or thumbs down? Like or dislike? Very good, kasi madami din kaming ginawang research. Thank you. Okay, moving on. Okay, ito pa pala, part of diagnosis. Within children with leptospirosis, what are the signs and symptoms predictive of disease severity? So 4 studies showed the following to be signs and symptoms predictive of severity. These are, if your patient already has pulmonary symptomatology, then shock, of course, altered mental status, and signs of bleeding. And with regards to ancillary tests, this is actually a table that we summarized. that looked into the laboratory tests that can predict the possibility of complications. So for example, platelet count less than 50, a serum creatinine of more than 200. Now you see a lot more tests like lactate, amylase, the number of leptospires that you see, your urea, your protein, and albumin. But coming from this and looking at the practicality of it all and looking at what we have in our clinical setting in the Philippines, then this would be our recommendation. Okay, so a low platelet count, high serum creatinine, abnormalities in potassium are the more practical and available tests. So parang CBC, CREA, electrolytes. No? And this would actually be practical enough for us to be able to say or predict the possibility already of complications in leptospirosis. Okay? So again, strong evidence and strongly recommended. Hindi naman natin kailangan gawin lahat ng tests na yun. Okay, let's be practical about things. Okay. Okay? Okay? Yeah? Okay, good. O, di ba? Madali. Okay, treatment. Okay. Again, unfortunately, there really are no randomized, but Cecil showed you the hierarchy of the evidence levels, no? Unfortunately, for leptospirosis, there are no randomized controlled trials done exclusively in pediatric patients. So we have a few of combined studies again, wherein they were looking at children 4 years up to adulthood. So these are mostly the studies. But coming from these studies and looking at all this data, and let me just move on with the recommendation. So this is now our core group recommendation for uncomplicated leptospirosis. I would just like to put into perspective a bit on our recommendation on doxycycline. Diba? Is there any apprehension in using doxycycline for children? Because this recommendation is regardless of age. So we all know that the use of tetracyclines have been limited in children primarily because of its adverse effect on the permanent staining in developing teeth. But increasing incidence in, for example, the Rocky Mountain spotted fever, Lyme disease elsewhere, and even bioterrorism involving anthrax, then they did a lot of studies on tetracycline, specifically on doxycycline. And they saw that in the newer researches, there was minimal staining that was seen and associated with doxycycline, primarily because, I think this is kind of molecular, but doxycycline has lesser chelation with calcium. And this chelation compound or molecule is the one which actually deposits in the enamel of the teeth. So lesser for doxycycline there. In fact, doxycycline, the AAP, is now the drug of choice for Rocky Mountain spotted fever. And even for, let's say, anthrax and bioterrorism, together with ciprofloxacin, doxycycline is one of the drugs of choice already for anthrax. So first line for uncomplicated leptospirosis will be doxycycline, 2 to 4 milligram per kilogram per day for 7 days, but with a maximum dose of 200 per day. Now second line will be amoxicillin with that 50 milligram per kilogram dosing, and azithromycin. The azithromycin has a lot, well, not a lot, but studies also in terms of the treatment in leptospirosis, but we put it second line, and we thought about this because of azithromycin. We don't want azithromycin to be abused because of the potential for the inducement of resistance with the use of azithromycin. Now, what about moderate to severe disease? Ito, historically naman, it was penicillin. Okay, first line treatment for severe leptospirosis is penicillin at 250,000 to 400,000 international units divided into 4 to 6 doses. Or an ampicillin at 100 milligram per kilogram per day. every 6 hours, or divided into 4 doses. Alternatively, then you may be using your third generation cephalosporins. Talagang 20 minutes lang ang binigay sa akin, ano? Hindi, okay lang po. Hindi. Okay, like. Okay, fine. Lastly, 15 minutes to go prevention. Again, there's nothing there. But based on a randomized controlled trial, they found that there was no permanent yellowish discoloration of the developing teeth after doxycycline in the treatment of asthmatic patients with atypical pneumonia. So they were saying, this article was saying short-term use of doxycycline may be considered as chemoprophylaxis against leptospirosis for children even below 8 years old. So this is our core group recommendation. First line is still doxy, single dose at 4 milligram per kilogram. Maximum dose is still 200 milligrams. Now you have to remember that if these children are exposed for more than 7 days, then the dose must be repeated after 1 week. Okay. Alternatively, then you may use amoxicillin and again azithromycin. Okay. Just a few more slides. Yes? Okay. Just a few more slides. So general guidelines. 1, of course we know this already. Parents should instruct their children not to wade, but if it's really not avoidable, then they should be wearing protective gear. Now, all food and drinking water should be protected against contamination. You have to boil your water for at least 10 to 15 minutes. And food should be also be protected against rodent attack and contamination. So if children are exposed to flood waters, then you have to give your chemoprophylaxis. And of course, exposure to animal farm water runoff should be avoided. Vaccination of domestic and even farm animals are variable, and there's still no vaccination for humans with regards to leptospirosis. Okay? So, these are the top 3 recommendations coming from the core group. 1 in diagnosis. Math is not routinely recommended, but you may be using your rapid diagnostic test, but you have to know when to use it. Okay, 5 days at least into the course of the illness. For treatment, uncomplicated, we advocate doxycycline. For severe, it's penicillin. For prevention, still is doxycycline. Alternatively, you can use amoxicillin and azithromycin. Okay, so before I end, I would like to acknowledge my group also. Okay, the diagnostic chair, Dr. Mean Banyes, treatment chair and members, of course, Melba Masigan, and prevention chair, Carmen Rivera. Okay, so with that, thank you very much.